hope you've been good. Welcome back to my channel where I share my life experiences and the lessons that God has given me through them. And I share those hoping that you may be encouraged, motivated, and empowered. This video is about free medical advice, right? Yeah, let's get right into it. So the first one is, not because you feel better, that means it's an empty gym. Awesome, my favorite. Anyways, not because you feel better means that you should stop taking your medication. It more than likely is the medication why you're feeling better. If you haven't been doing any lifestyle changes at all and you've just been taking medication and then you start to feel better, clearly it's the medication why you start to feel better, right? So many times in the office as a doctor, and you have patients that come and tell you, oh, that I feel better, so I'm stop taking pressure medication. So the morning you see them, because they have stopped taking their pressure medications, the pressure is through the roof or going higher than their normal baseline, right? Or they're coming to the doctor's visit and they tell you, oh, because I was coming this morning, I was rushing and I woke up too early, I didn't have time to prepare anything to eat, so therefore I did not take any medication. And I'm like, when you come to me now with this high pressure, I don't know what's been happening the whole time. Have you even been taking your medication? It's the same with the sugar too, right? Those are the two main ones I always see people play around with, their blood sugar meds and their blood pressure meds. So as we talk about your health, subscribe now for more encouragement from my channel. Like, comment, and share. Yeah. You know what I always tell my patients who say, oh, they didn't take their medication because they didn't eat this morning? I say, what you should have done, oh, this lighting is nice. What you should have done is you should have taken breakfast with you to the health center or to the hospital or whatever. Taking your medication with you as well, because clearly if it's 5 o'clock, not everybody takes medication or eats at that time, and I understand. But if you take something with you and you have it while you're there sitting before you see the doctor, because even at a health center, for example, people come out like 6 o'clock to get number and all of that. Fine, I get it. But prepare ahead and say, I'm going to take my medication and I'm going to eat something. Even people who they know they're supposed to eat, like people with ulcers and stuff like that, telling you, I rushed out. So you're coming for the pain, but you haven't done anything for the stomach pain, but you haven't done anything to help with the stomach pain. You get what I mean? Makes no sense. So I always tell them, carry something to eat, carry your medication with you as well, and just eat it while you're sitting there and take your meds. Whether it's something you need to, sometimes, people need to take the medication before, half hour before, after, or whatever, or with meal. Do what you need to do. Yeah, so that's another thing too. Next thing, you don't come to the doctor and say, I'm having an eye pain, I want antibiotics. So you don't come to the doctor and tell the doctor what you want. What you do, you come to the doctor, you tell them what your symptoms are. This and this and this are happening. The doctor, because they have studied for years, they go through based on what you're telling them, and they're like, okay, this is the diagnosis, right? Based on what you're telling me, this is what it is, and this is what you need. Not everything warrants an antibiotic. I realize in Jamaica, we have this culture of, I just want an antibiotic. Just give me an antibiotic, let me go. But the more antibiotics you take, the more resistant the bacteria becomes, or bacteria become in general to the antibiotics, and later they will have no use. So giving you antibiotics is actually harming you. So when you're actually sick and have an infection that needs antibiotics, right? It can't help. It can't help, or you have to get antibiotics that are even so much more powerful because the bacteria that you have, they are resistant. Another example of that is people have a cold. Most colds are virus-based, meaning, they're viral infections. Antibiotics are not for viral infections, they are for bacterial infections. But we're so into I need an antibiotics that we believe everything is an antibiotic. So don't go to your doctor and tell them what you want. Tell them what's going on with you, and then they'll tell you what you need. Do not lie to your clinician. That's the next one. Do not lie. I've had patients come and they're telling you, oh, I take my medication. Just as basically, this is not about medication, but I've seen this many times. Oh, I take my medication and I do this and I do that. But when you question them properly and you check, you realize no. So your doctor cannot help you if you lie to him or her, right? You cannot be lying to your doctor and expect them to help you. You have to be plain and straight, right? If you lie, we can't put the pieces together. Funny enough, sometimes you still get to put the pieces together because you realize that this patient is lying. You're like, this story is not adding up, right? Yeah, so that's the thing. Do not lie to your doctor. It makes no sense whatsoever. Okay? It only hurts you and you're wasting the doctor's time, because if you say A, but B has been happening to you, okay, we all make mistakes and you may have done something you shouldn't have done. Doctors are not supposed to be judgmental, right? They're supposed to be like, I'm here to help you. Just let me know. It is what it is. You keep lying. How is that going to, help you at all? So make sure you tell your doctor the truth. Very, very, very important. So if a patient says they took their meds, but their blood pressure is high, right? Clearly, the meds need to be adjusted, or depending on how high it is, they may need to go to the A&E, right? Yeah. But if you did not take your medication now and your blood pressure is high, that's a whole different thing. That's just because you didn't take your medication, right? But if your blood pressure is high after you took your meds, we need to know so we can adjust it, whether that's pressure or if your sugar is high after you've taken your meds. But if you're going to lie and say you took them and they're still high, and then your doctor adjusts it because the doctor believes you, got no signs that you were lying, doctor believes you, then the doctor adjusts your medication and sends you off, that can lower your blood pressure or lower your sugar too much. So again, you're hurting yourself. Do not lie to your doctor. Segueing now from lying to your doctor, there is patient doctor confidentiality, which means that your doctor is not at liberty to share anything with anybody about your health, right? That is against ethics. And just in general, that's just not okay. Yeah? All right. So when you go to your doctor's office, try not to be nervous. Try not to be scared to share anything. It's not lying now, but sometimes patients are scared because they think the doctor is going to feel a certain way about it or tell somebody about it. And share with your doctor that, something happened to me. I'm sharing some sensitive information right now and I feel nervous about it. Sometimes that helps because your doctor might just say something to help you get the edge off, right? So it's best to be very open, be as open as possible. Ensure that you say everything you need to say. Sometimes patients will come and they will be like so scared. I have to calm them down. And I'm like, just try to know you're going to the doctor this morning. You're going to be open. You're going to tell them everything because that is the only way they can help you. Make a list of all the issues. When you're going to go to your doctor. People don't just get up unless it's an emergency and say, I'm going to the doctor now or tomorrow. People don't just get up and just say, I'm going to the doctor, right? So, write a list. Don't go to the doctor's office. You have 5 complaints. You go to the doctor's office, you talk about 2, then you leave, you're like, oh my gosh, I forgot these 3. Make a list of the things that are bothering you for the past month, 2 months, 3 months, since the last time you went to the doctor. Yeah? Make a list. Can't hurt you. Tell the doctor I have a list of 5 things. Make the doctor look through them and tell you, okay, this is that. Sometimes just a simple thing, and then others need to be delved into. Don't wait until the end of the interview when you're going to leave through the door. You're like, Doc, I remember. That's not okay. Other patients are waiting. You have to also be considerate. And you're not only going to take your mental health seriously, you're going to take the mental health of others seriously. I realize we can be very insensitive. I think I'm going through this, so nobody else is, or my mental health is serious, but somebody else, we laugh. We call them the 3-letter word that I'm not going to say, but we don't take it seriously. Yeah? And definitely, last but not least, have a relationship with God. He's the creator of your being. He's the one that created you. Why wouldn't you, as it relates to health, your health, right? And as a doctor, my advice to you is ensure that you have a relationship with him. Your devotional life should be going. Your prayer life should be going. I'm going to link my video here about how to hear the voice of God and the Holy Spirit. Very important. But don't ignore the laws of your body. Don't ignore when your body is talking to you. Don't push. Just push and overdo it. Like you have a car and you hear your car, you hear some sounds. A normal person wouldn't ignore the sounds in their car, right? They'd be like, I need to go to the mechanic with this because I'm not going to drive this. And they'll take the car to a mechanic. So take care of your body to the doctor when it needs to go. Take care of your body. Rest when it's telling you you're tired and you need to rest. Just so super important that we do all these things. Once you go to your clinician's office, do not make any plans for that day, or the hospital. Listen, the doctor's office, anything can go wrong with anybody, not only you, but with other patients. So you have to be patient with other patients, right? And you have to understand that anything can go wrong. So where you go and I rush a sick person? That make no sense. You tell me, say, but that me have somewhere to go and make plans, and don't make any other plans for that day. Yes, another thing, your nurses and your doctors and your healthcare workers in general, they are humans too. They have a family. They can get tired. You have to think about it like that as well. Yes, you are sick, but these are people too. You have to think about them and say, oh boy, maybe this person is this and that and whatever. Sometimes we can be very demanding and we want this and we want that, but we're not thinking that once the person said they're going to come and they're going to do it, that maybe they're doing something for somebody else when you ask them to do something for you. Yeah? And it's not that they're neglecting you, but they're also humans too, and they might forget because you might have a long list of things. Working in the hospital system, I can tell you, gets very overwhelming, right? And they can have something to do too, and they promise you, and then I see it has happened with me. Promise the person, and then I pass them, and I say, oh my gosh, I forgot, I'm gonna do it now. A little bit of long suffering would go a long way. A little bit, yeah. Long time a day and a long time a day. Don't, all right? Please, may I beg you know. Your medical professional, whether that's a doctor, nurse, not only medical professionals, but other people like lawyers, business people too, right? They have a life. So unless you are super close to them, I don't believe a doctor or a nurse's phone should be going off at 3 a.m. in the morning because there's an issue. Because remember, this person has a life, this person has to sleep too. It's best, if you have an issue, to go to the hospital. And more than likely, you're going to call them and they're going to tell you, go to the hospital. Because that is what the accident and emergency department is for, accident and emergency, right? And I do find that people will call about the slightest things. So you have a pain in your back for months, for years, and you're going to call at 1 a.m. or 3 a.m. about that. You're disturbing that person's sleep. You have to be considerate. You have to think this person has a family, this person has a life. When I order things, or if I'm dealing with somebody and say, okay, for example, I have a lawyer, right? It's just a scenario, and I want to ask a question by him or her. I will message the person, say it's a Sunday, and I don't want to forget. My first line is, I know it's a Sunday, I don't expect you to respond to this until tomorrow, but I just don't want to forget to ask, so you send that out, yeah? And after you send that out, you expect that you get your response back, fine? Yeah, the next day. So I do that with a little disclaimer, my friends can call me all the time and ask me medical questions, that's fine. But if you have a doctor's number or a nurse's number or your lawyer's number, I think you should be as considerate as possible. Is this really, really an emergency that I need this person for now? And you evaluate that. And you be considerate in the process. I know sometimes when we're stressed, we're just like, I need help right now. What am I going to do? But you have to take a step back and think these people are persons too, and they also need time for themselves. Just like how you don't want to be called about work outside of your work hours, I don't want to be called about work outside of my work hours, straight up. Right? And that's everybody. Everybody wants to be done with work and home and enjoy their life. And this field is so demanding that I don't want nobody calling me about work or anything work related. You get me? So yeah. Last but not least, I gave this advice, yes, but these are not anything new to us. I think some of them are even just common sense. The spiritual lesson I get from this, though, is the fact that medically we will ignore these things and I'm not having a headache, or I didn't have a heart attack, or I didn't get a stroke, so I can skip my hypertensive meds and I can eat all the salt I want. It's kind of different with diabetes, because people tend, when their sugar go low, they feel it. When the sugar go very high, they can sense it. That's different. Some people will also sense their blood pressure going high as well, but hypertension is known to be the silent killer for a reason. Anyway, I say that to say people will neglect their medication and neglect what the doctor says because the place is not on fire. They're not, as I say, having a stroke. They didn't have one. They didn't experience that before. People have told me before, the pressure always high. This is nothing new. And I'm like, that's not normal. That's not okay. It's actually silently mashing up your kidneys, mashing up your eyes, right? Destroying your heart in the same breath. And this is the same thing with sin, because we feel okay and we're going to church and you had a good time and you pray and you feel good, or meaning you pray like once a while and you feel good, and you go to church and you had a good worship service and you feel good, then you're fine. And you don't understand that sin is eating you alive, and the end result is deleterious to your health, to your life, to your health as it relates to those health conditions, and to your life as it relates to your spirituality. So I implore us today, don't neglect our health, whether that's our spiritual health or our physical health, because in the end, you want good health. That's the goal, to live a life that is fulfilling, to live a life that somebody don't have to be wiping your bottom because they got a stroke and you lay there like a vegetable, as well as you don't want to be spiritually dead. The goal in sight is heaven, right? And if the goal in sight is heaven, we have to do everything we need to do day in, day out to work towards that goal, which is our devotional life needs to be up, our prayer life, surrounding ourselves with people who support that. So have a good day. Be encouraged to work on your health, your spiritual health, and your physical health today. All right, like, share, subscribe, comment below, click the notification bell so you'll know when I release my videos. But my videos are released Tuesdays at 6 p.m. and Thursdays at 8 a.m. All right, bye.